So I guess I'll start this just by saying that I'm not here to speak for any of the people that we serve, but rather speak up.
Yes.
Now can you hear me?
Yeah.
Okay. So I was saying I'm not here to speak for any of the people that we serve, rather just to amplify some of the stories that they've shared with me. As many people have mentioned earlier, we know that being homeless, or rather experiencing homelessness, puts you at a greater risk of shortened life expectancy as well as other co-occurring conditions, which exacerbate symptoms of coronavirus if you're compassionate. Lack of sleep and rest, constantly being stressed out from having a street-based life, pre-existing mental health conditions, including substance use disorder. These are all things that make life, being homeless, very difficult. We know that having a home increases your likelihood of being well, increases your likelihood of having, stable income, on and on, sorry. And there's also a great stigma attached to homelessness that we all are very aware of. The stigma when coupled with other conditions like substance use disorder makes it very difficult for people to obtain employment and receive the social supports. Higher. Okay, I feel like I'm yelling right now. Okay, let me get myself together. All right, so like I was saying, higher incidence of mental illness and or substance use disorder makes it really difficult for people to deal with the potential of catching this virus. Unique challenges are faced by returning citizens, which is another way of saying people who are released from jail or prison. They face unique challenges that also increase their chance of experiencing homelessness. You're actually 10 times more likely to experience homelessness if you've been released from prison, and this increases with the amount of times you've been incarcerated. A sister mentioned earlier that women of color and children are the ones most vulnerable to experiencing homelessness, and also the least likely to receive services. Okay, so there are just some facts to provide some context. What I think is more important to talk about are our demands, some of which have already been shared, including the fact that we need to empty the shelters, and we need to move people into hotels, not permanently, they're not to stay in those hotels, but to get them off the street. And while they're in those hotels, we need to make sure that we have the services available to them to provide permanent supportive housing. There are very many examples around the country of organizations that have done this. And we in Baltimore are actually perfectly suited because we have the best hospital in the nation, one of the best. And they have an exorbitant endowment, which can be used to support the building and maintenance of permanent supportive housing, which would also greatly decrease their cost of treating people experiencing homelessness. As we know, many folks, it's kind of a revolving door. You're in and out of the hospital, treating your abscesses, treating your overdoses, just all of the things that come with being a drug user in Baltimore City. And it costs a lot of money to keep those people healthy. And sadly, even with all that money, they don't last very long. So I'm calling on the Hopkins system, that's both the university and the hospital, to donate some of their funding, really a drop in the bucket for them, to create housing for people experiencing homelessness, the same people that they treat daily. I'm calling on the Mayor's Office of Human Services and the Department of Public Safety and Correctional Services that is so adamant on incarcerating people for their means of survival, including sex work and drug use and sale, to increase and to strengthen their reentry program. The last report that their reentry program wrote was published in 2013, and there's yet to be anything out of that office since then. Yet somehow they continue to receive funding. And lastly, I want to, and people have talked about this 30 million that the state has. The city is also receiving 6.5 million, or actually has already received 6.5 million, and it's going to increase in something called the Emergency Solutions Grant, which is specifically to address homelessness as a result of coronavirus. So they need to allocate those funds without all of the competitive nonprofit industrial complex measures that are using having people pit against each other for scraps. They need to give us that money and let us do what we know how to do best, which is house people and take care of them. I think I'll stop there. Thank you for listening.